Friday, everyone. I'm Dr. Shira, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Welcome to my vlog, A Dose of Reason, where I answer your questions about the COVID-19 pandemic and provide you with the information and knowledge to help you make the best decisions for yourself and your family. You can send me your questions about the pandemic, the upcoming flu season, or anything related to infectious diseases to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll select a few questions each week to discuss in the vlog. Our first question comes from Susan in Brookline. She says, I got the Pfizer vaccine 6 months ago. I have high blood pressure, so I believe I'm eligible for a booster. Should I get the Moderna vaccine as a booster? I heard it's better. My husband got Moderna, but the booster isn't approved yet for him. Should he just get another dose anyway? And my elderly mother got J&J. What should she do? Thanks, Susan, for this question. The booster story is pretty confusing, so let me try to outline it for you. As long as you're over 18, you are eligible for a booster given your high blood pressure and the fact that you got the Pfizer vaccine. You would also be eligible even with no underlying medical problems if you're over 65, live in long-term care, or are at high risk for exposure due to your work or institutional setting. Now, data are suggesting that Moderna recipients are not experiencing the same degree of waning or diminishing of their immune response. But that may be due to the fact that Moderna was given with a 4-week interval rather than a 3-week interval. So that difference is likely no longer relevant once you get that booster that's at least 6 months out. Now, your husband has to wait for the Moderna booster to be approved. The Moderna booster might end up being approved at a lower dose. So I don't recommend that people go out and get a Moderna shot, which would be at a dose that might end up being twice the dose they actually need to boost their immunity. And unfortunately for now, your mother needs to wait for the J&J booster to be approved. But the good news is that the FDA's advisory committee is meeting October 14th and 15th to talk about the Moderna booster and the J&J booster, and it's expected that after that they will expedite the approval if it is recommended by their advisory board. Our next question comes from Brianne from Marshfield. She says, Dr. Shira, can you please explain the public school testing plan for kids with symptoms and kids who have been exposed? And if my child has been exposed, why can't I seek my own test? Why do I have to use the school's program? Okay, so Brianne, the most important thing to know is that the school nurse will help you navigate this should either program be needed by your child. But here's a quick summary. If your child is enrolled in the diagnostic testing program and develops symptoms that could be consistent with COVID-19 during the school day, the school nurse will do a shallow nasal swab that has results in 15 minutes. That's a rapid antigen test. Now, there's a list of symptoms that the nurse goes by, and for some of those symptoms, a negative rapid test is all that's needed to return right to class. They might need another test in a few days if they still have those relatively minor symptoms. Now, for other symptoms, more substantial ones, they'll need to go home and get a PCR test to return to school, even if that rapid test is negative. As long as they're fever-free and feeling somewhat better with a negative test, they can come back within a day or so, as long as it takes you to get the results of that test. Now, for kids who are close contacts, and this is only unvaccinated children, vaccinated kids are essentially not considered exposed. There's the Test and Stay program. And Massachusetts is really a leader in this area because the Test and Stay program is amazing. What happens is that if your kid is considered exposed, that means that they've been within 3 feet for at least 15 minutes with masks on, or unmasked within 6 feet for at least 15 minutes, and this happens at school, but not outside and not on the bus, those exposures don't count, then they will get a rapid test every morning on their way into school for 7 days, and they can keep going to school and all the extracurriculars that are associated with school as long as that test is negative in the morning. Now, no, you cannot get your own test as part of this Test and Stay program because the beauty of the program is that you're tested right before you spend the day in school. And every day during that time, that incubation period when you might become infected after the exposure. but it's still a lot better than having to be quarantined and be at home for that time. Our last question comes from Drew from Boston. He says, I read that Merck has a new pill for COVID-19 that prevents hospitalizations and deaths. This sounds too good to be true, is it? Well, it is quite promising, actually. Merck issued a press release on their drug molnupiravir. It's an oral pill that, when given to clinical trial participants, and these were participants who had confirmed mild to moderate COVID, they were all unvaccinated, and they had at least one risk factor for severe COVID, it reduced the risk of hospitalization by 50%. So specifically what happened was they did an analysis of a trial and they had enrolled 775 patients. Over 14% of those who received placebo ended up in the hospital and 8 died. Only 7% of those who received the drug were hospitalized and none died. Now, these results were so striking that the External Data Safety Monitoring Committee stopped the study early because it was no longer ethical to keep giving anyone placebo. So I'm really hopeful that we'll see this drug on the market soon because I really think it could be a game changer. But importantly, it does not take away the need to be vaccinated. Remember, 7% of the people who took the pill still ended up in the hospital. The vaccine is more effective than that. So if you're not vaccinated, get vaccinated. That's all the time we have for this week. Please keep your questions coming to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.